So the most common symptoms of knee arthritis are pain, swelling, and stiffness. So if I give you an example, when the patients come to me and I ask them what problems they have, if they're coming with knee arthritis, the most common symptom which they describe is the pain. The pain can be varied. It is usually, they describe it as a dull toothache-like pain, which sometimes get worse with any activity. So that's the most common symptom of knee arthritis. Some people also complain of swelling in the knee, which comes and goes, and it also depends on what they have been doing. So it increases with more activity and then settles down with rest. The third common symptom which patients can have with knee arthritis is feeling of stiffness. Now that stiffness, sometimes it is because of the significant arthritis, or sometimes it can be as a result of the swelling in the knee that they find it difficult to move the knee. So those are the most common symptoms of knee arthritis. However, depending on what part of the knee is mostly affected, some people do come in with the feeling that the knee or the leg feel just give way, or they find it difficult to kneel on their knee, or they find it difficult to manage stairs. And those are because of the knee arthritis is affecting more the behind the kneecap. Okay, so those are the common symptoms of the knee arthritis. There can be different causes of knee arthritis. Most of the knee arthritis patients which we see, so they got wear and tear just with the age and the level of activity which they do. However, if somebody's been involved in an injury and they have fractured the top end of the shin bone, then that can result in arthritis. If somebody has injured their knee, which resulted in the meniscal injury or the cruciate ligament injury, then that can result later on into the knee arthritis if those injuries they have not been dealt with properly. Some people, they do have bowed legs, so which means that the alignment of the limb is not correct. And an example of a car tire, so it just keeps on rubbing on one part of the tire more than the other, and they end up with the arthritis in the knee. So those are some of the causes of knee arthritis. Another big group of arthritis is what we call as inflammatory arthritis. So the examples of those arthritis are either rheumatoid arthritis or psoriatic arthritis. So again, those are the examples of it's not affecting just the knee. So they've got an inflammatory process going on, affecting multiple joints. The knee is part of that whole spectrum. It's a very good and interesting question. And the way I answer that to my patient is that it's a balance. So any rehabilitation or any exercises which you are doing and it is causing you pain, then it's probably not the right thing to do. So what I would suggest is to do the balanced exercise. What does I mean by the balanced exercise is that you do exercises within the pain barrier, within the pain limits. Now, that doesn't mean to say that you should not be taking any painkillers, and if you're in pain, then you should not be doing any exercises. Because if you do that, then what will happen is that the muscles will start to waste away. Because they've not been working, they've not been moving, so they become weaker. And then the whole vicious cycle of pain gets worse with time. On the other hand, I do not want my patients to keep taking morphine or any of the stronger pain medication in order for just to do the exercise so they can keep them moving. So the balance would be that yes, they are taking simple analgesia if required just before or after they do the exercise, but I would encourage them to do the exercise to keep them moving, to break the cycle of stiffness and pain. And again, some of the exercises are much more easy in the sense that they do not cause that much pain. And quite a lot of my patients, they do like what we call as an aqua therapy. So they are in the swimming pool. They're not doing any exertional activity, but they are able to move their joints, especially the knee, without it hurting too much because the gravity is not in play there. So I would recommend, on balance, I would recommend physiotherapy or exercises, but again, within limits, so it does not cause too much pain. So when the patients come and see me, I explore what treatment they have. so far. And I would try to maximize all the treatment which I can before I consider surgery. The reason for doing that is that surgery is a powerful procedure to help them with their symptoms, including the pain, stiffness, and mobility. However, there are certain risks associated with the surgery. So I do not want to put my patients through the unnecessary risks of surgery if I can help them or control their symptoms with other things which are available. And the way I discuss with the patient is kind of a mutual decision. So I can guide or help my patients, and I don't dictate what they should or shouldn't have. If they are stuck in making a decision, then I can provide them with enough information so they have all the information available to make an informed decision. So I start with the simple painkillers. Some people, they already have been taking the regular painkillers. They do not either tolerate it or they do not get any benefit from that. If the simple painkillers does not work, then we can offer either in the form of an injection, the form of the physiotherapy. Sometimes the braces work as well. When everything else fails, and the patient is come to that stage that it is affecting their quality of life, it is affecting their activities of daily living, they're unable to enjoy life, they're unable to sleep, then that's the time to have an intervention to help them to break their cycle and get back to the normal. So I believe that any intra-articular injections into the knee, they have a role in helping patients with the symptoms. Unfortunately, there is no cure for arthritis at the moment. So all those gel shots or other type of injections, they can control the pain by reducing the inflammation. So in my practice, I do give them either the steroid injection mixed with the local anesthetic. And again, that effect can last from a few weeks to many weeks to months. Or the alternative is what we call as hyaluronic acid injection. That's in common terms, it is known as artificial joint fluid injection. So again, they've got a different mechanism of action, but again, their effect potentially can last longer than the steroid, and they can be repeated over the years. So again, I would use those injections as part of the spectrum or the tools which I have to help my patients with the pain control. And again, or another indication would be that somebody had just a flare-up and they just wanted to get over that flare-up and is not helped with the local anesthetic or the pain medication, then again, this is a good option. Or if somebody is not ready for the operation or not keen for an operation, so these things are there to help them manage their symptoms better.